Hello friends, today we are going to discuss about assessment of cognitive function in clinical setting. I'm Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Today we are going to discuss about assessment of cognitive function bedside or in the OPD. Let's understand why do we have to do cognitive assessment and also the interpretation of the finding of your assessment. Let's understand about cognitive functions. Cognitive functioning refers to multiple mental abilities such as consciousness, attention, concentration, memory, intelligence, judgment, insight, and so forth. So the cognitive function, they are multiple in nature. They are a broad term used for the assessment of mental faculty that is considered as cognitive function. And here we are going to discuss about bedside assessment of cognitive function. Of course, the bedside assessment of clinical cognitive function is basically going to pick up severe to moderate cognitive dysfunction. However, it will not be able to pick up the milder cognitive dysfunction. That means you'll be able to pick up gross cognitive dysfunction. Moderately to severe cognitive dysfunction can be easily picked up by clinical bedside examination. However, for the milder cognitive deficits, you may have to do a proper structured neuropsych assessment. Coming to this, since this bedside clinical assessment does not pick up mild cognitive dysfunction, it has a lot of false negative is very common. So whenever you are suspecting mild deficits, please do refer them for neuropsych assessment, especially with regard to clinical cognitive assessment, which will be done for 5 to 15 minutes. And it is done by all mental health professionals like psychiatrists, doctors, primary care physicians, nurses, social worker, and clinical psychologist. And before you start cognitive function assessment, please do observation, look into the file, collate information, and also see what is the speech and assessment of the patient. So the cognitive function is not a standalone. It has to be along with the clinical picture. Then only the cognitive assessment interpretation becomes very accurate. Let's understand what are the different components of clinical cognitive assessment and functioning. The cognitive function which we are going to assess clinically are consciousness, orientation, attention and concentration, memory, intelligence, judgment, and insight. Let's now discuss each one of them. First, we will discuss about consciousness. Please do remember, when you start your assessment of the cognitive function, look at whether the patient is awake, aware, and responds to stimuli. If the patient is not alert, is very drowsy, and stuporous, there is no point in doing cognitive assessment. Hence, you have to attempt when the cognitive function only when the patient is alert. So please do mention the patient is alert. You discuss that telling that patient is conscious and alert. If he is drowsy, please do mention that the patient is very drowsy because of maybe receiving sedation. Document it, and the cognitive function can be attempted once the effect of his injection or the medication wears out. Moving to the next, orientation. Orientation is very essential to know the difference between organicity and the functional illness. In organicity, invariably, the patient has severe disorientation. Basically, the orientation for time, place, and person. Let's know how to assess for assessment of for time. You ask the patient what is the approximate time of the day. And if he is able to tell, and if it is within the plus or minus 2 hours, that is 120 minutes, that means the patient has complete orientation for time. If there is any disturbance, ask him whether it is a morning, afternoon, evening, or night. And if he is able to answer to some extent, and you want to be make further sure, you can ask, what is the day today? Which week? What is the date? What is the year? What is the month? Can be asked. So that becomes the orientation for time. Next, you can ask for orientation for place. What is that place where he is staying? Which is the city? What is the area name? Those kind of things can be asked for orientation for place. ask for orientation for person, whether the patient is able to identify himself, whether he is able to identify his family members, friends, relatives, and is able to identify the hospital staff. Then we can say, yes, you will say, my impression is patient is oriented to time, place, and person. If he is not oriented, you will clearly mention that he is disoriented. Once you have made, if the patient is alert and oriented, then only you will continue with the cognitive assessment. If the patient is disoriented and is not alert, then you are going to stop here, mention that, and if it is required, you have to make a aggressive investigation to know what is the cause for disorientation and altered sensorium. Moving to the third important point, attention and concentration. If the patient is alert, consciousness, you will assess for attention and concentration. For to know the attention and concentration, attention means if the patient is able to focus on a task, it is called as attention. If he is able to hold that attention for a sustained period of time, then it is called as concentration. So the concentration and the attention can be easily assessed by using digit span test. For example, if the patient is able to sit with you and answer all the interview for a period of 30 minutes, that means invariably by indirectly he is being able to tell attention and concentration is well maintained. However, for the purpose of completion, you have to do digit span test, that is digit forward and digit backward. Whenever you are doing this digit backward and digit forward, you have to give instruction clearly to the patient. The assessment should be done in the patient's mother tongue, not in the foreign language, because the patient will be very comfortable in his mother tongue. Or else, if the patient is comfortable in the language, you have to do the assessment. Whenever you are repeating the digit, it has to be one number per second. For example, digit forward, you have to give an example. I'll be telling 3, 7. The patient has to repeat 3, 7. And again, you have to ask for 6, 1. The patient will be repeating the same. So the maximum number of digits he is going to tell forward, that will be the digit forward. And at the same time, you will ask for digit backward. In this, you are going to tell a word, the number, the patient has to repeat backwards. So the interpretation will be the number of digits forward and digit backward he is able to tell. If the patient makes a mistake, you may repeat with another example without repeating the same number, and same digits will be used. The numbers will be different. Coming to the further assessment of concentration, serial subtraction test will be done. That is, for example, serially you ask the patient to subtract 1 from 20 and further. For example, he has to, that is called as 20 minus 1. He has to start 20, 19, 18, 17, 16, 15, 14. So how many seconds he takes and how many mistakes he does. If he's able to do that, ask for 40 minus 3. Whether he's able to say 40, 37, 34, 31 completely in 60 seconds, how many mistakes he does. And also 100 minus 7. So this is called as serial subtraction. And you have to document number of mistakes and time taken. And if he's able to do to a certain extent, then we call it as attention and concentration is aroused and sustained. Suppose if the patient is illiterate, he is unable to do all this mathematics. What should we do? Ask him to tell the number of name the days in a week, like Sunday, Monday, Tuesday, Wednesday. If he's able to name them, ask them to repeat forward and backward. The time taken, you are going to document. Similarly, name the month in a year forward and backward. So that will be easily doable by the patient. So then you're going to interpret, yes, the patient's attention and concentration is aroused and sustained. That means concentration, attention and concentration is there. Moving to the fourth important point, assessment of memory. In the memory, there are 3 important points: immediate memory, recent memory, and remote memory. Immediate memory is nothing but digit span test and also serial subtraction test, where the patient is able to repeat what you have said that. Coming to the recent memory, there are 2 important ways of asking or doing the test. One is 3-word test. You will be giving some 3 words which are unrelated, for example, rose, wheel, and fire. and you will ask the patient to repeat it, and also you will give an instruction after 5 minutes. I'm going to ask him that you are going to ask him again, and within this 5 minutes you have to distract him and engage him in some other activity, and after 5 minutes ask him to recall all the three unrelated words what you have given. And that is one. And another one is address test. You give a address of a person which is maybe hypothetical in nature, which has 3 to 4 characters, where the patient has to repeat, and after 5 minutes he has to again remember and repeat it. And also one of the other way of doing is recalling the events which has occurred in the 24 hours back. For example, what did he had in the morning breakfast, whom did he meet yesterday night, what dinner he had, and in the dinner who were the people who are present with him. Those 24 activities which has occurred, he has to recall. But however, you need to have an informant who can corroborate those events, so that if it is there, you'll say recent memory is intact. Coming to the remote memory, you can assess by 2 ways. One is asking personal information about his date of birth, schooling, occupation, where was his college, what is the name of the college, what is the name of the teacher, all those information, and friends, name of his childhood friends. So, but however, you need to have a family member who can corroborate all these information. Then it will become remote memory is intact. Suppose there are no family members, then you can ask for semantic information such as when did India got independence, when do we celebrate the Republic Day, and what was the month, what is the date, and also who is the Prime Minister of India, who is the father of nation. Such a common information which every person knows should be asked, and if he is able to recall them, we call it as memory is intact, and if he is not able to recall, then we call it as impaired. Moving to the important fifth point is assessment of intelligence. This becomes very crucial to know whether the person has any problem in his intelligence. The intelligence is assessed with 4 important things: general information, that is general fund of information, what we call it as comprehension, arithmetic, and abstraction. Now we'll go back to general fund of information. For every person, you can ask for name few local rivers, name them. Name few freedom fighters. Name 5 states in the country. Or else, if he is illiterate, you can ask 5 crops, or name 5 food grains that he knows. Name 5 language spoken in the country. Name 5 animals. So such questions can be asked to know the general fund of information. Further, you can ask him what is the political events which are occurring. Who is in the ruling party? Who is in the opposition party in the state, in the center? So those kind of general fund of information will be very helpful, though that will give us some clarity about his intelligence. Next, you can ask for his comprehension. Like comprehension can be assessed, what will you do if it is raining and you have to go outside? What will you do if it is very cold? Like what is the answer he is going to give you? And also you can give 3 command tests. For example, you can say, you can put a paper in front of him, ask him to pick up the paper, fold it 4 times, and then keep it in his pocket. So these various command tests and how he is able to comprehend them will give you the information about the comprehension. Coming to the arithmetic. Again, assessing for arithmetic is basically simple calculation ability, addition, subtraction, multiplication, and division. You have to do both verbal and written. Verbal is a simple calculation can be given. If a cost of a pencil is 20 rupees, how many you can buy in 200 rupees? A simple calculation can be asked. If you want to ask for division, if there are 18 boys and you want to divide them into 6 groups, in each group, how many boys are there? So these are such questions can be simple way can ask. For example, you can also ask if the 1 kg of tomato is 5 rupees, what is the cost of 1 dozen kgs? How much you have to pay? So such questions can be asked to know whether the arithmetic ability is there or not. Again, with regard to written, you can give single number, single digit addition, subtraction, multiplication, and division. Similarly, next the 2-digit, 3-digit, and if he's able to fairly do, go ahead forward assessing for abstraction. Abstraction is assessed with regard to differences, similarities, and proverb. Invariably, you have to do the differences first, then similarities and proverb. Human brain is very well been tuned to pick up differences. For example, for a paired object, he has to find out the difference. Ask the patient what is the difference between stone and potato, difference between dog and a lion, difference between apple and an onion, difference between iron and silver. How he responds on that basis, you will go to similarities. Here you will be giving a two pair again the objects and he has to say what is the similarities like orange and banana, eye and ear, north and west, table and chair. So he has to talk about the similarities. Coming to the proverb, you ask the patient, does he know any proverb? If he is able to tell the proverb, then you ask him to give the explanation. Whether he is able to conceptualize the information of the proverb, it will be excellent. For example, if the patient says, I know a proverb like barking dog seldom bites, and he is able to give an explanation and an example for that, that means his abstract thinking is well preserved. That here, now you are going to say his intelligence, like your impression may be, yes, he has an intelligence of slow, like maybe mental retardation may be there. You may have to comment, or else dull normal intelligence or subnormal, average or above average intelligence. You can comment here based on your clinical findings. Moving further to the judgment. Here it is basically decision making capability. What will he do? Again, we are going to assess the judgment in three important things: personal judgment, social judgment, and test judgment. Personal judgment, you can ask him, what will he do immediately, the future plan? That means if he is admitted, you will ask him, what will you do after going home, after discharge? What is his immediate plans? If he is able to give a good logical explanation, that means personal judgment is preserved or intact. And the social judgment is based upon his behavior in the past 2 to 3 days or 1 week. That is basically historically. Historically, you are going to assess in the past 1 week. For the test, you can ask for fire test, phone test, or accident test. Fire test is basically you ask the patient, if your neighbor's house is caught on fire, what will you do? For a phone test, if you have got a phone which is lying on the road, what will you do with that phone? Accident test, if a person has met with an accident and you are passing by, what will you do? So these, on that basis, you are going to say whether the judgment is intact or impaired. Coming to the last part of it, it is insight. Insight is basically knowing whether he is aware that he is ill, what is the reason, that attribution for his illness, whether he is accepting for treatment. Based upon that, you are going to say whether he has absent insight, partial insight, or he has present, that insight is present. Suppose the person is able to say, yes, I have some mental illness and it is because of certain reasons, problem in the brain, and I'm ready to accept for treatment. Means his insight is present. If the patient says, I don't have any problem, that means it is absent. Suppose if the patient says, yes, I have a problem, but somebody is doing black magic. Because of that, I'm having this problem. And I'm ready to do whatever it takes to get rid of this problem. That means it is partial insight. However, the insight further can be discussed and graded depending upon 1, 2, 3, 1 to 6. There are various 6 different grading of insight can be done. The grade 1 will be considered complete denial of illness. Second one is slight awareness, but he continues to deny. Yes, I have a problem. I don't think it is an illness. Yes, I have something going in my hand. Maybe some problem is there, but it is not an illness. That is grade 2. Grade 3 is he is aware that he is sick, but he blames the external agency. He may say neighbors are doing this, hence I am getting fever. So that is the attributing for the external factor. Coming to the grade 4, he is aware that he is ill, but he doesn't know what is the reason. That means the patient says, yes, I am having hearing of voices, but I don't know why it is happening. So that means he's not attributing to something else. he doesn't know simply. That is grade 4. Grade 5, he knows that he is suffering from an mental illness, but he is not ready to change. He says, I may take treatment, I may not take treatment, and he is not ready to do any behavioral changes. That is called as intellectual insight. Coming to the grade 6, he has a true emotional insight where the person is aware of his illness and he is ready to take treatment and he is ready to make changes in behavior, so that is considered as true emotional insight. To conclude, my dear friends, the cognitive assessment in the bedside consists of consciousness, orientation, attention and concentration, memory, intelligence, judgment, and insight. Before I conclude, please do remember this: cognitive function is not a standalone. It has to be done along with the observation of the patient, history, looking into the past history, current clinical history, and the cognitive function. The comprehensive assessment will indicate the patient's cognitive deficits and the diagnosis. Thank you for your valuable time. And if you like this video, please do subscribe to our channel. Stay safe.